oligohydramnios that occurs when you have too little amniotic fluid. Amniotic fluid is the fluid that surrounds your baby in your uterus. It is very important for your baby's development. Earlier, I posted a short video about oligohydramnios on this channel, and today I am going to discuss this illness in detail. Well, first of all, let me tell you, how do you know if you have oligohydramnios? I mean the signs and symptoms. If you notice that you are leaking fluid from your vagina, tell your healthcare provider. It may be a sign of oligohydramnios. Your provider watches out for other signs, such as if you are not gaining enough weight or if the baby isn't growing as fast as he should. Your healthcare provider uses ultrasound to measure the amount of amniotic fluid. There are two ways to measure the fluid. The first measure is amniotic fluid index, that is AFI, and the second is maximum vertical pocket, that is MPV. The AFI checks how deep the amniotic fluid is in 4 areas of your uterus. These amounts are then added up. If your AFI is less than 5 cm, you have oligohydramnios. The MPV measures the deepest area of your uterus to check the amniotic fluid level. If your MPV is less than 2 cm, you have oligohydramnios. You should ask your healthcare provider if you have a question about these measurements. Now I'll tell you what problems can oligohydramnios cause. Okay. If oligohydramnia happens in the first 2 trimesters, in the 6 months of pregnancy, it is more likely to cause serious problems than if it happens in the last trimester. Okay. These problems can be birth defects, that is, these are problems with your baby's body that are present at birth. Miscarriage, that is when a baby dies in the womb before 20th week of pregnancy. Another complication is premature birth, that is the birth before 37 weeks of pregnancy. Also, stillbirth can occur, that is when a baby dies in the womb after 20th weeks of pregnancy. If oligohydramnios happens in the 3rd trimester of pregnancy, it can cause the baby to grow slowly. Problems during labor and birth, such as the umbilical cord being squeezed. The umbilical cord carries food and oxygen from the placenta to the baby. If it is squeezed, the baby does not get enough food and oxygen, and then there is a greater chance of needing a cesarean section. That is when your baby is born through a cut and the doctor makes in your belly and uterus. Earlier on this channel, I posted a video about polyhydramnios in which there is excess of amniotic fluid. That is also very informative video. You can see that video. The link will appear in I button. Okay. Now I will tell you what causes oligohydramnios. Sometimes the causes of oligohydramnios are not known. Some known causes are health problems such as high blood pressure or pre-existing diabetes, that is having too much sugar in the blood before pregnancy. Certain medications like those used to treat high blood pressure. If you have high blood pressure, you should talk to your healthcare provider before getting pregnant to make sure your blood pressure is under control. Post-term pregnancy, that is a pregnancy that goes 2 or more weeks past the due date. A full-term pregnancy is one that lasts 39 to 41 weeks. Birth defects, especially ones that affect the baby's kidneys and urinary tract. Okay. As you know, the amniotic fluid with basically initially in the initial stages, it comes from the mother. The water from the mother. But after like 20th weeks, this amniotic fluid comes from the baby's urine mostly. Okay. So let's say if there are problems in the kidneys or urinary tract, if they are not developed, then obviously the urine will not produce from the baby, or it will be blocked, and that can also contribute to this low amniotic fluid, oligohydramnios. Okay. So these birth defects are very important that can contribute to the development of oligohydramnios. Okay. Then there is another condition, that is premature rupture of the membrane, that is PROM. That can also lead to this. When the amniotic sac breaks after 37 weeks of pregnancy but before labor starts. So this can also cause oligohydramnios. Okay. Now I will tell you about the treatment of oligohydramnios. If you have a healthy pregnancy and get and get oligohydramnios near the end of your pregnancy, you probably don't need treatment. Your provider may want to see you more often. She may want to do ultrasound weekly or more often to check the amount of amniotic fluid. I mean, if oligohydramnios happens in the last trimester, which is which usually is the most common period in which this occurs, then you hardly need any treatment except for the monitoring. I mean, your healthcare provider will ask you to come for ultrasound more frequently. Okay. But there are other ways of treatment, like sometimes amnioinfusion can help prevent problems in the baby. Amnioinfusion is when the provider puts a saline solution, that is salty water, into the uterus through your cervix, that is the opening to the uterus that sits at the top of your vagina. This treatment can help prevent some problems such as the umbilical cord being squeezed. If the umbilical cord is squeezed, the baby does not get enough food and oxygen. If the fluid gets too low, or if your baby is having trouble staying healthy, your provider may recommend starting labor early to help prevent problems during labor and birth. However, with regular prenatal care, chances are that your baby will be born healthy. Okay. So now I'll tell you what can you do if you have oligohydramnios. Drinking lots of water may help increase the amount of amniotic fluid. Your healthcare provider may recommend less physical activity or going on bed rest. What is the frequency of oligohydramnios? This I should tell you. About 4 out of 100, 4% of pregnant women have oligohydramnios. It can happen at any time during pregnancy, but it is most common in the last trimester, that is the last 3 months of pregnancy. It happens in about 12 out of 100, 12% women whose pregnancy lasts about 2 weeks past their due dates. If there is a case of due dates, the pregnancy is, like 2 or more weeks delayed, then the chances of getting oligohydramnios are 12%. Okay, because if the pregnancy is prolonged, the due date is passed, then the amniotic fluid usually decreases by that time. So that contributes to the oligohydramnios, which I already discussed. Okay. So this was my video about oligohydramnios. I hope you like this video. If you have any questions about oligohydramnios, or if you want to discuss any other illness for which you can't find the video on this channel, please post your comment in the comment section, and I'll try to post a video about your illness as soon as I find a time. Thanks for watching this video. See you in next video. Bye for now.